Well, hello again, everybody. It's Heather LaPaglia with Seniors Blue Book Live. Um, I have with me today Kyle Harder, and he's with VITAS. He's going to talk to us a little bit about his role and the services that VITAS provides.
Hi, Heather. How you doing?
Oh, thanks. Thanks for being with us here today.
Oh, thanks for having me.
Certainly. So talk to me a little bit about your role and how long have you been with VITAS?
I have been with VITAS about a year and a half. I started last year in January, so probably about a month or so before things got closed down a little bit. I work with a team of representatives, and we work with doctors, we work with hospitals, nursing homes, assisted living, personal care, and our role is really to educate and also to try to increase access to people for hospice. To make sure that those people that are eligible, that could access hospice are able to do it, and educate the physicians, social workers, nurse practitioners, nursing home administrators on, what type of patients would be eligible.
You talked about education, and I think that's huge because when folks hear the word hospice, I think there might be a little bit of misconception, misinformation around that word. Talk to me about what hospice really means to VITAS and the practices that you all put in place.
Sure. I think, one of the things I think that surprised a lot of people think of hospice as a place, and hospice really is a service. Hospice can happen anywhere. And we really, the goal of hospice is to have people comfortable in whatever setting that they choose, whatever setting's appropriate. Most of our patients do receive hospice at home, but you can also receive hospice in a nursing home, in an assisted living, personal care home. And we do also have some contracts. We're able to do inpatient hospice in a hospital or in a facility if that's where people need to be. People think that hospice is really for people right at the end of their life, and hospice really has a lot to offer people, and not just at the very end of their life. It certainly does have a lot to offer then, but there's so many services that people can get at hospice, and it's really a big support not only for the patient or the resident, but also for their families, for their caregivers. It's really a service that wraps around that person, and tries to make them comfortable and also support the family in that as well.
Fantastic. And I know there's several, not more, probably more than several hospice agencies in the area. What makes VITAS separate than those other agencies or different?
Well, first of all, VITAS has been in this business for a very long time, since the 70s. And hospice is what we do. We don't, have another type of service that we provide. We don't have home health or anything else. Hospice is what we do, and that is really what we know. And we consider ourselves advanced illness specialists, and we provide the care that makes someone comfortable. We try to get people at home if they can. And we've had a lot of patients that want to be able to leave the hospital and go home and be surrounded by loved ones, and we're able to do that. We can provide a lot of complex type of treatments at home that people would be surprised to learn that they can also get at home. They don't have to be in the hospital for that. So this is what we do. This is what we take a lot of pride in. We really enjoy being able to help people and to be comfortable where they're at. And the clinical support that they can get at home is 24/7. We have after hours clinicians that people can get to. We even can provide what we call intensive comfort care. Intensive comfort care is where someone maybe has some symptoms that are acting up and they're uncomfortable, and we can provide clinicians right there at the bedside for up to 24 hours a day if needed for that, until those symptoms kind of subside a little bit. These are services that a lot of hospices aren't going to provide for you. In addition, we have a lot of services like chaplain services, social workers that also can provide supports, like I said, not only to the patient but also to their loved ones and their family. That caregiver burden is a real thing, and it's difficult. People spend a lot of time and effort trying to take care of their loved ones, and they need support as well. We have volunteers excuse me, that can come in and help the patients. They can provide, we do we do bears. We take someone's clothing and make that into a stuffed bear that someone can have afterwards, which is a tremendous support to the families afterwards. We also provide bereavement services for up to 13 months after a patient does pass away. We can still provide services for that family as well.
Wow, that's fantastic. And I'm sure you get this question a lot. Are any of your services covered under insurance to take that financial burden off of families?
Yes, absolutely. And in fact, for Medicare, these services are covered at 100%. There would be, really no out-of-pocket expenses. There's no copays. All the medical equipment, all the prescription medications that someone would need for hospice is all provided as part of that benefit. Even on private insurances, those are covered as well. There might be deductibles or things like that that have to be met, but these are all provided at 100% for the patients. So unlike home health or some other services where there might be a copay per visit, that would not happen in hospice.
If someone is considering the option of hospice and thinking maybe it's time that they become admitted under those services, what's the turnaround time for that? Let's say they're at home. How quickly could they be seen and admitted under VITAS services?
That can happen the same day.
Okay.
We have teams that are ready. We have an admissions team that's ready to respond whenever they're called upon. And like I said, that would be in the hospital, the home, the nursing home, wherever that patient is at. And we can bring someone on to service that day. In fact, most cases, almost all medical equipment can be delivered that day. So there's no delay. I've talked to social workers before, and they said, I've tried for 6 months to get someone a hospital bed or to get some oxygen or to get a wheelchair. And, it's taken months and they have to go through the approval process. We can get that stuff delivered in most cases the same day.
That's fantastic. Were any of your turnaround times or services delayed by 2020 COVID pandemic issues, or did everything pretty much stay the same as far as responding quickly?
Yeah, everything stayed the same. We were able to provide, like other medical offices, we were able to provide telehealth. So in cases where we were not able to go into the hospital or go into the nursing home, immediately we're able to provide those services via telehealth. And even in cases where families were concerned about having people into their home, we're able to provide those services via telehealth. So, we can still do that as well if that's appropriate. But no, our services were not delayed by COVID. We're still able to go in and help the families as needed. Our staff, by and large, have been vaccinated. They've taken a lot of precautions to prevent the spread of COVID and to keep themselves safe and to keep the patients safe. And they're willing to go in and help anybody that needs their help.
That's fantastic. It's definitely a service that's very, very needed and will continue to be so as well. So I appreciate you educating myself and the folks watching this too. Anything else you want to share with us, Kyle, as we wrap up here?
What we do, we also have an individual that works at VITAS that's able to do what we call goals of care conversations. And, if anyone's interested in hospice, they're not sure what it entails, they can call us and we can come in and help them and just kind of educate them on not only hospice, but other services that are out there for them as well. So advanced care planning, someone's goals for what they want their treatment to look like is very important. It's important to sit down ahead of time and decide, what do I want? I have this diagnosis. What do I want my care to look like? Where do I want to be? What do I want my family members to know? These are things we can assist someone with in talking about that after they've received a diagnosis that maybe they're not sure what it really entails. And sometimes it's uncomfortable and people are not sure how to have these conversations. But these are conversations that we are comfortable with having, and we think provides a lot of empowerment to patients and to families to know that, this is what I want, and for the family members to know, I'm providing the care that my loved one wants, and I'm going to make them as comfortable as possible. So, if anyone is interested or just wants more information, we're happy to do that and just provide you some education as well.
Fantastic. What would be the best way to get that information? Is there a phone number or email address?
Yeah, if you want to go, our website's vitas.com, and there's a ton of information on there for you about hospice and about VITAS. If you want to call our local office, it's 412-799-2101. And, we're available there to help you. That's 412-799-2101. And if you want to call in and say, I just want some information, and we're happy to do that over the phone. We can have someone come to your house and talk to you about that. But, there's a lot of options. And, most people, when they come on to hospice, most people say, I wish I would have known about this sooner, because it's provided such a support for me and my family.
Absolutely. Well, thank you for your time, Kyle. I really appreciate it. This has been fantastic education for our viewers. And I hope that we get to talk real soon.
Yeah, thanks, Heather. Very nice to meet you, and great talking with you.
Great. Talk soon.
Bye-bye.